Time for our weekly Health Watch segment. As always, we are joined by Dr. Syed Hussain of Trinity Health of New England, and this morning we have quite a few interesting topics to talk about. Welcome back, Doctor.
Thank you.
So excited to jump into this first one. There's some new guidelines for folks who are interested in getting a COVID-19 booster shot. So what's new this time around?
Yeah, the FDA just released some guidance, Symphony, which is a little different from what we've done in previous years related to COVID-19 vaccines. So the guidance basically states that if you're 65 or above the age of 65, or if you're younger but you have a risk factor, a high risk factor, then you should be eligible for the vaccine. Okay. Now that runs counter to what we've done in the last few years, which is anybody above the age of 6 months, we recommend you get the COVID-19 annual shot. So what I'm looking forward to is the CDC's Advisory Committee on Immunization Practices, ACIP, that meets next month to see what recommendations they put forward.
Okay. Now this next one, I bet a lot of folks will have eyes on, as there are plenty of families across the country who are dealing with or caring for someone who's experiencing Alzheimer's, or there's just some way indirectly impacted by that. We all know someone who's been impacted. Now there is a new FDA blood test. The FDA has cleared a new blood test. It's the first to test for Alzheimer's disease. So can you tell us how this differs from other tests?
Yeah, I'm excited about this new development. To your point earlier, though, we have around 7 million Americans that live with Alzheimer's. That's 10% above the age of 65. It's actually slated to double by 2050. So there are going to be more people diagnosed with and living with Alzheimer's. So this is the first blood test, and this test looks at proteins in the blood and basically looks at the development of amyloid plaques. These are clumps of protein that are hallmarks of Alzheimer's disease and will enable patients to really easily get this test done at home. Once it's positive, along with some symptoms, initial symptoms of Alzheimer's, they may be eligible for treatments. And we know there's so much development happening on the Alzheimer's front. Now, for viewers, Alzheimer's is characterized by memory loss and the loss of thinking skills. Just the day-to-day activities, that takes a little bit of a beating. It's progressive, so it gets worse. But anything we can do to make it easier for diagnosis. Right now, there's a PET scan, and those can be expensive or not available everywhere. There's radiation exposure, so I'm excited about this blood test.
Yes, and they can do it at home.
That's right.
And that could be a game changer for folks who may have difficulty actually getting to a physician's office.
Right, absolutely.
Right. Okay, one more. We often talk about, how exercise is good for you, but there's a new study that shows simple exercise can lower your risk of developing several different forms of cancer. So what types of exercise should folks be doing, and how often, or how much of it daily, rather?
Yeah, this adds to the growing body of evidence related to exercise and cancer risk. So this is a large study out of the United Kingdom. 85,000 people looked at, for about 6 years, followed for 6 years. And what is the association between exercise, whether it's light, moderate, vigorous exercise, and cancer risk? So in people in the study who actually had 5,000 steps, there was a reduction in cancer risk. Looking at 13 types of most common cancers, 7,000 steps equated to 11% reduction in risk for developing cancer. And 9,000 steps is about 16% reduction in risk. So long story short, get moving. Exercise is good for you, especially as we grow older. It will help, with various aspects of staying healthy.
Yeah, so get outside, especially now that we're getting some nicer weather.
Right.
Get outside, get those steps in. I try to get my steps in, make sure I close my rings on my watch.
Likewise.
I got to be honest, Doc, sometimes when I wake up in the morning, my bones sound like they snap, crackle, and pop.
Right.
So I try to keep moving. Thank you so much for joining us.
Absolutely. Thank you for having me.